And we are live, so welcome everyone to Think Young COVID-19 Vaccine Hesitancy and Immunization, Innovating Vaccine Delivery for Youth webinar. As you know, we realize and we create several webinars on different topics, but the one on vaccination and COVID-19 is one closest to our heart, and that's why the whole team is very happy that we have been able to organize this webinar. We obviously all have been affected by COVID-19 and by the pandemic. The crisis sparked. We are now getting into the third winter where with COVID being around. The European Commission has little influence on national health policy, this we all aware, but unity is what is requested all over Europe to make sure we're able to solve the problem with COVID-19 and that together we are able to advance for a better healthcare for everyone. So the European Parliament in around early 2022 launched COVI. It's a special committee that was established in March actually on COVID-19, and we're very happy that we have 4 speakers with us and getting straight to the point. As Think Young, we started a vaccine coalition in 2019, so even before COVID, we were trying to understand a bit vaccine hesitancy among young people. And then when COVID came, obviously, Vaccine Coalition, us and many other organizations that are also here today have been trying to do their best to help society. We're very honored to have 4 very special guests joining us today. Tomislav Sokol, who's member of the European Parliament. We have Hamid Trimesh from mRNA Vaccine Manufacturing Engineer at Arcalis INC, and Hamid is actually in Tokyo, so thank you very much because we appreciate you taking the time to be with us so late for you. Caterina Silva, who's Vice President of European Affairs at EPSA, the European Pharmaceutical Student Association, and Silva Gurbus, who's Public Health Director for the European Medical Student Association. Before we start with the question, a message to everyone who's listening to us. There's going to be the last 15-20 minutes a Q&A session. So whatever platform you're watching this, whether it's the different one, which I don't mention to don't give any visibility to anyone, just write a question there in the comments, and our team in the background will be picking up the best questions or the one that are more linked into the webinar of today, and then we'll pose them to our speaker. Ideally, you also mentioned the speaker who would like to reply to you. Otherwise, it's just a general question. Put it there, and then someone will pick it up. I just introduced your name. I didn't say anything about your bio or your organization because I like you speakers to do it. So we'll start with MMP Sokol. Could you explain your role as a member of the European Parliament COVID committee and tell us a bit about what you are doing in that respect, in that position?
Okay, thank you. First, I would like to thank you very much for inviting me and for organizing this. I think it's a very timely event, and I think it really talks about still a very important topic, even though some other things like the war in Ukraine have overshadowed the topic of COVID, but COVID is still here, and we should definitely discuss what we have to do in the future to reduce the number of victims, obviously, and the number of people infected, but also to learn about the lessons that we learned from what happened before. As you said, I'm a member of the COVID committee. It's a special committee which was specifically created with a limited mandate of a bit more than 1 year. It will be prolonged to 1 year and a half to determine the Parliament's position and to make some recommendations about what lessons we learned from the COVID-19 pandemic. Apart from that, I'm also a member of the ENVI committee. That's the standing permanent committee on environment and public health. And my background is I'm not a medical doctor, but I'm a professor of health law at the university. I did my PhD at KU Leuven in Belgium on cross-border healthcare and EU health policy, health law and policy. And I've been writing a lot and participating in a lot of projects, including Jean Monnet projects in the academia on European health law. So this is kind of my specialty. Thanks.
Thank you very much, and that was perfect and straight to the point. Moving on to Caterina, can you please tell a bit about the work that EPSA has been doing during the COVID-19 pandemic, especially regarding to the vaccination program?
Yes, of course. First of all, thank you for having me as well. I'm Catarina from Portugal, just to introduce myself a little, and I'm currently based in Brussels. In EPSA, I remember that in the beginning of the pandemic, when we didn't know the dramatic numbers that the pandemic could reach and the massive impact that it would have on the society, that we promptly made some and took some measures and gave some sanitary recommendations for our live events while they were still possible to happen. So really at the beginning of the pandemic. And I think then we didn't know for sure that would be only the first step of what would we do and what would we be advocating for regarding COVID-19. Since then, since the beginning of the pandemic until now, we have released a position paper on mental health and how it has been impacting our students, our European pharmaceutical students, their mental health, and with rethinking and implementing some structural changes in students' mental health supports. Together with ESSAS, and here EMSA is already with us in this chat, and together we have later also released a documentary on mental health, exactly regarding this aspect and how much it has impacted the society. Together with some of our members, we have released as well a position paper in vaccination. So we have looked at this COVID-19 pandemic as a way to as well influence young people regarding vaccination, how meaningful it is, and the ways that pharmacy and pharmacists can help with a public response to COVID-19 to reach members, to reach member states, to reach national ministries, to reach universities, and for something to change regarding hard skills and trainings on vaccination topics. And then another structural and very important area for us, and that we focus on a lot, is public health. So we want to fight the limited health literacy that there is. And then from the beginning of the pandemic until now, we've done a lot of public health campaigns, both online or in person, because we want to reach our young audience and the students that we represent as well on COVID-19, on the steps to prevent the spread of coronavirus, on the benefits of vaccination against COVID-19, because it is a safer and more reliable way to build protection at the end of the day, and decreasing as well the symptoms associated with disease. Every year we celebrate the Immunization Week. So we use this week as well to demystify some questions that our target audience, so the young people that follow us, have in regards to vaccination and the process of and that process and its benefits. And right now, especially during this pandemic, the importance of vaccination to protect our community.
Thank you very much. Thank you, Katarina. And Sila, same. If you could please introduce yourself and the work that EMSA has been doing during COVID-19 pandemic, and also what you guys are focusing on right now.
Okay, thank you for your kind invitation, first of all. So my name is Sıla Gürbüz, and I'm fifth year medical student in Turkey, and also I'm current public health director at European Medical Students Association, as you said. So EMSA worked on several projects on the topic, beginning with the pandemic. And the most important one was we conducted a survey to assess European medical students' knowledge, and includes questions in the medical curriculum, and also their awareness and concern levels to shape our work. And then we organized 2 webinars on vaccines and public health, and also COVID-19 Vaccines 101. And we launched some materials such as vaccines booklet and also policy papers on vaccine hesitancy and vaccination passports. We created numerous social media contents to raise awareness of vaccine hesitancy and immunization, such as in the Immunization Week. So we also focused on this year, we also focused on other vaccines and immunization in general to be sure that they are not to be overlooked because of the COVID-19. And in short, I can say that we focus on the topics using power of social media.
Thank you very much, Sila. And then last but not least, Hamid, if you can introduce yourself, give a bit overview, also the situation in France, because you're from France, and what has been done with respect of COVID-19 as well.
All right, thank you. So my name is Hamid Trimesh. I'm 30 years old. I'm an engineer. My background is in chemical engineering, but I've solely worked in vaccines. So I've been working as a vaccine manufacturing engineer for the past 6 years. Basically, my role is to design, build, and operate manufacturing factories for vaccines. So I've had quite some good experiences and a lot of opportunities in my previous position. I was based in France. I had the opportunity to go abroad and to work on many factories in Asia, in Europe, also in South America. So I've been exposed to a lot of, let's say, a lot of countries, a lot of factories, and a lot of vaccines, from rabies, pneumococcal vaccines, influenza vaccines, but also very recently to COVID vaccine. And I've been working for the past 2 years now. Since the pandemic has started, I was sent to Japan for the production of a COVID vaccine. And I recently moved to Japan a month ago to join another vaccine manufacturer, which is a bit smaller, but which is focusing on new technologies, and especially the mRNA vaccines, which we've all heard about, and we probably all of us around the table had this vaccine because it was the new technology that, let's say, was the game changer throughout the pandemic. It was the first time we've had two vaccines developed very quickly and widespread, and we had produced several billions of doses, and we managed to cover, let's say, most of the people, and to stop to stop the pandemic, and to reduce the burden that it had on the society. So that's what I do on my job. Regarding the situation in France, so I've left France a month ago, but the situation is quite still fresh. Basically, what is happening right now, and I think it's the same all around Europe. We are pretty much back to normal life, but we cannot say that the pandemic is gone. That would be quite a mistake to say that we are finished with the COVID. It's not the case. We've seen very recently in France that cases were increasing. We've had a new wave coming up early September and now in October. So we've had really very recently the French government pushing the elderly populations to try to engage in having the fourth dose to boost their immunity. And we recently have in France the new variant vaccine, so that was released a week ago. So now it will be used in priority for elderly population and weaker population to get vaccinated and to get a better protection in this winter, because the virus have shifted a lot since since the 2 years. It's a new variant that we have. So the protection that you get from the previous vaccines have dropped a little bit. So having new vaccines right now that are more adapted to the new variant in circulations will work as a booster, and it will increase the level of immunity that people will get when they get the vaccination shot. So that's what's going to happen in France right now. The other point that's very hot topic in France at the moment is that next week the influenza vaccination campaign will be open in France next week, and what the healthcare agency and the government are trying to do is to increase the level of immunization regarding influenza, to avoid having in the coming months a double burden. So having the burden of influenza on the society, but also a high rise of the COVID vaccines. So that's the two battles that they are waging at the moment. So influenza vaccine will start next week, and for sure they will push to have people get more vaccinated for influenza as well as for COVID.
Thank you very much, Hamid. I think you started already mentioning, that the fact that vaccination play an integral role in preventive healthcare policy. So that's it helps to prevent the spread of a common disease, but also it helps financial system not to have a too high financial burden on them and too much pressure from patients. And so it's quite intuitive, the fact that vaccines are helping out our society. But from many studies, also one we've done at Think Young, we see that there is in young people, sometimes even in young parents, an hesitancy, there is a growing concern for this tendency to be hesitant when it comes to vaccination, not just COVID-19, but also other, I would say, established vaccination, for example, against HPV. And Katarina, you come from a student association, you are young yourself, and you're a pharmacist, so let's say forefront of and very trustworthy as well point for young people or for the public at large. How do you think pharmacists and student pharmacists as well could better communicate the benefits of vaccination so that they are more appealing to young people?
Well, I think that to find a solution and to make it more appealing for young people, we need to start from the end and reflect on why there is so much vaccine hesitancy among young people. And the most common responses to that are that people are afraid of adverse effects because they lack on the knowledge of the vaccine and the adverse effects that they could have. They lack the confidence on vaccine safety, sometimes due to rapid development, such as the example that we had with the COVID vaccines. Sometimes because of the distrust that there is in the government itself. So I think there are besides that, a lot of myths and misconceptions and fears that young people have, and because they are not, they don't have the expertise on it, it's harder for them to be influenced and to get the vaccines. So I think healthcare workers in general, pharmacists included, of course, need to influence. They do influence the vaccine decisions, and we see with patients. Actually elderly patients as well, that sometimes when the vaccine is recommended by a healthcare worker, it's more likely that the person itself would be getting the vaccination. So this should work as well for young people. We should have pharmacists try to overcome this hesitancy by providing facts about vaccines, by including efficacy and safety data, because they are young, and we are talking about young adults, but they know how to understand data when they are shown that data. And when you provide people and provide young adults and young people with the data and the proof, it will be more likely for them to accept the message that you're trying to portray. So it's by emphasizing the pro-social benefits of vaccination, in particular the possibility to achieve a immunization within the community and protecting others, especially those that cannot be vaccinated due to allergies or other type of impossibility. I think basically it's in the message that we want to portray to young people, not only trying to have an impact, an empathic vision and an empathic portray, but as well have people that deliver those messages that are kind of influencers in a sense to them, so people that they can relate to, that they can that they are trustworthy, that are relatable. And if we have people like this portraying these messages and using platforms like social media, because nowadays young people are a lot in social media, and it's a way easier tool. And if we do use these tools that are given to us to try and portray these messages, they will eventually influence the young people to get vaccinated and tell them the benefits of vaccination, so that we all together can gain immunization as a whole for the community. So it's basically on the message and the message provider.
Thank you very much. And I mean, I think the beauty of what you guys are doing is that, you know, you're doing it as a student organization, so you're still very much in your young years, and you're among students. You are a student yourself. Sometimes when you're in this association, so that really plays an important role, as you said. You know, influencer being able to communicate with an honest and empathic message. Speaking about the student organization, EMSA published a paper last year calling its members to engage in public action and participation with regard to vaccination awareness. Sila, can you tell us briefly how successful was this campaign? How did it go? Some news on that, and maybe something that you guys learned out of it, or something that you think should be repeated.
Yeah, that's true. It was about the action. Before that, we provided some tools to for the facts and the right resources to reach knowledge about vaccines. And to support this call, we have held several webinars on the theme of vaccine communication, as I said. And it was about how to take action and tackle some challenges, which includes primarily we faced was how to talk with our vaccine hesitance relatives. So after that, these efforts began while we are writing this paper, because this paper, which was written after many exchanges of ideas with different members, and it includes our recommendations from our members to our members, also to the World Health Organization and the European Union and many organizations. So due to the pandemic, maybe naturally and unfortunately, I'm not sure that we were able to achieve the success we aimed for, because we have observed very common fatigue, exhaustion, and the other mental health problems caused by the pandemic among young people and among our members. So this led to a lack of motivation and the engagement to our work. But we also received a good amount of engagement, but it was not what we expect. And as I said, we also witnessed the amazing work for our members. And we hope that it will continue, and this motivation and the engagement will increase.
Thank you, Sila. And I appreciate that it's already the second time we mentioned mental health, because it's really something we see when we study young people. It's clearly a growing concern. MEP Sokol, there is clearly an important part, which is the access to vaccine and vaccination for young people. There are physical barriers on top of all the mindset, but there are physical barriers. There are, you know, insufficient transport links that prevent sometimes willing young people from accessing vaccination. Do you think that mass vaccination programs, as we've seen recently, for example, targeting potentially schools or colleges, could be a way forward?
Thank you. I mean, yes, there are barriers, and this is a problem, because one of the things that I'm also personally advocating in the parliament is to achieve equal access to healthcare for everybody in the European Union. Without that, we cannot speak about real European citizenship. Of course, this also applies to vaccination. In this, what you mentioned, this mass vaccination could be one of the solutions, but we have to be really careful there. Because first, what is essential is that this is not perceived as something that is being forced upon people. Because especially in case of children, in case of schools, this is something very sensitive. And I have to say, those, let's call them anti-vaxxers, have often used this list in my country, but I think also in other countries as well, these situations related to schools, limitations on which were placed because of the pandemic and all the epidemiological measures, to also manipulate the public, because public is very sensitive towards children, and if something is perceived as being forced upon them or their parents, then that can also be counterproductive. So this is something that we really have to be very careful. We have to prepare the ground well in terms of the media, in terms of the public perception, and what was mentioned, I think it is very important, what was mentioned before by Katarina, that using people who the young people can relate to is something very important. because if us old politicians come to the lectern or to TV or something and try to preach to them or give them lectures about epidemiology about self responsibility and things like that, that can also be counter-effective. So I think it's important that this message is explained and spread in a very clear manner, of course science-based manner, so that it is facts-based, but also in a way which can be close to them. And I have to say one thing which is also very important actually about this trying to play the empathy card, if I can say that. We tried to do this in Croatia. Our whole campaign, public government campaign to promote vaccination was based on that think about yourself, think about others, your grandchildren, your grandparents, your parents, etc. Get vaccinated. But this has unfortunately proven to be, I will be perfectly honest, proven to be not very successful, because a lot of people are selfish, essentially. And there are already some analysis which show us that actually this was the wrong emphasis, that this is one thing which is important, but that we should have placed more emphasis, especially within the vulnerable groups, within the vulnerable population. These are not usually young people, that we should place more on the benefits for them, for them personally. I have to say, because as I said, I will be perfectly honest, so there are limitations to this approach. It can be one part of the whole thing, but I think that we should also focus more on benefits to people who are getting vaccinated. This can also be young people, so young people are not considered to be a specifically vulnerable group, but still there have been cases of young people having suffering very strong consequences of COVID. Some people also dying. There are also many young people who have other comorbidities which make them more vulnerable to COVID. So we should also, I think we should more focus on these categories, on these kinds of things, and because this playing the empathy card, let's say, has shown its limitations, unfortunately.
Thank you very much, and that's definitely an interesting insight when we look at communication and then the right way to communicate, and the same with access. If we move a bit on to another part, I mean, in the research we published before the summer on young people and vaccine hesitancy, there was one clear point when it comes to COVID-19, which is digital health, e-vaccine passports. That was something that young people found it extremely useful, and they actually something that they would like to keep also, long term. It's it's a generation that it's constantly and frequently influenced and using digital tools. They have a natural facility in having them, and that's why they kind of, in part of the result of the research, they said digital tools are really what can really help long term for our healthcare. If we look a bit about this and digital healthcare, and I'm looking at Hamid, who's also an engineer, how do you think digitalization is changing the healthcare industry?
All right. So the biggest impact we've seen with the COVID and on the digitalization part is that it basically accelerated everything we were going through. We already had digital tools in place. Not all the populations were using them, but having to go through the COVID, having to go through a lockdown for a period of several months, we were by nature forced to switch to fully digital tools. So everyone moved to Zoom, Teams, and so on for their daily work. But it happened the same for medicine, for example. We all got used to telemedicine. In the past, we had the opportunity to meet doctors online, but this tool was not quite widely used. People were reluctant to use it. But with the pandemic, it was made very clear that seeing a doctor online for most of the cases was enough, and it was very well used among all the populations, and even more among younger people. So that was one of the first, let's say, the first big impact that digital had on the daily lives of patients relating to healthcare. The second one that we've had, and it would not have been possible without digital tools, was that we all booked our vaccine appointment online. And it would not have been possible to manage all the logistic around the vaccination without these tools. You have to know that if you take a shot of vaccines, you take it from the fridge at minus 80 degrees. You have to know exactly how many people are going to be vaccinated this day to do it. Otherwise, at the end of the day, you discard all the remainings. So you have to have a strong system in place to manage all the booking, all the let's say the cancel and so on. And this was done using online tools, and that was extremely helpful for in all countries where it was applied. It was extremely helpful. The other one that we had was of course the vaccine pass that allowed us to travel within Europe and also in other countries. For Europe, it was great because I think Europe was one of the first area where we had the vaccine pass, and it was recognized within the entire Europe, and then it was recognized outside of Europe, and we all had it on our smartphones, and it made things very easy to go and to cross borders. So that was quite let's say impressive on the digital part. The way I see it, and what I think should continue like that, is that, for example, on the vaccine pass that we had our results of PCR test if we are positive or negative. We had all the history of our dose that we took, first shot, second shot, third shot, what kind of shot was it, what maker, what, let's say, the brand of the vaccine it was. We had all these informations. So what I would like to see, and what will probably happen in the future, is that we'll have some kind of similar tool, but for all your, let's say, your vaccines, not only for COVID. You'll have a system, a database where you have all, let's say, your history of the vaccines that you've had. If you can manage to go back in the past and find the information, you can have it, and also all to keep track of all the future vaccines that you will have to do. Throughout your age, you have to do some boosters, and I bet that many of us do not know if they are up to date in their current vaccines. And that's the first thing to be. I mean, if you want to be protected correctly, you have to know, okay, what's my current status? Do I need to take boosters in a vaccine that I've taken 15 years ago? And without having the information, well, you don't know where to start. And having a digital tool in place, not a paper-based document, makes things very much easier. So I think we'll see that coming in the coming years, and it would be great if this kind of tool gets widespread use, because it facilitates a lot the work of, let's say, healthcare professionals, but also patients who want to know when they need to get vaccinated, what kind of vaccines they need to do, and to get information on the vaccines they will use through this system. So yeah, for sure, digital tools was also a game changer within the pandemic.
Thank you, Amit. And literally on point, this is also what I wanted to ask to MEP Sokol, the fact that you mentioned before we need a bit more uniting in Europe, and the EU digital COVID certificate was indeed an example of this cross-border health policy cooperation, and which is what really is helping a lot. And this collaborative approach, do you think it could be somehow recaptured to support, even in other topics, not just in COVID, more integrated healthcare systems for Europe, especially considering that young generation are extremely mobile in the sense that they change country frequently. When they start being over 18, they go abroad to study, then they go abroad to work, then they work in several European countries. Sometimes they go overseas, like Hamid in this case, it's in Japan, and then they come back. So clearly, to help this mobility of young people, which is one of the mega trends we see whenever we do studies on youth, having a digital certificate from the EU, a healthcare certificate, obviously, that you can carry everywhere and can be understood everywhere, because that's also a problem. When you enter an hospital, you don't speak the language, but there's something that can be understood by them. Do you think this approach could be somehow recaptured to support a more integrated healthcare system in Europe?
I will answer your question about the COVID certificate, but I have one question for you. How many of you have European health insurance card? Okay, great. So but you're probably not representative, but yes. So this is one example of something that we already have, which was meant to make mobility, especially for young people, for instance, students who are using exchanges, Erasmus, etc., to get health protection. So European health insurance card, for those who don't know and who are listening, gives you the right, the entitlement to get necessary health care if you are temporarily in another member state. Which is necessary for you to finish your planned stay there. For instance, that means if you are a student who is there for a semester or a year, that means they're entitled to complete healthcare, which is necessary to finish that stay there. And what is particularly important is that this European health insurance card gives you the right to be treated in the same way as if you were insured in that country, which means that if something is free of charge, if you are from Italy and you are traveling to Germany, studying in Germany for a semester, you have some accident, you're entitled to full healthcare under the same conditions as Germans. So if it is free of charge for Germans, then it's also free of charge for you. So this is one thing that we already have. We've had it for pretty long time, and this shows you what the European Union can do. Of course, healthcare is primarily a national thing, national competence. So it's so in the treaties which define who does what EU does and what member states do. Healthcare is primarily a national thing, which means that that EU cannot harmonize national systems. For instance, the EU cannot regulate which healthcare entitlements will you have, how much will you have to pay out of your own pocket, and the organization of the healthcare system, of primary care, secondary care, etc. So these are all things which are left to the member states. What EU can do is to regulate, is to facilitate free movement. So this is where EU has power. One of the things that I mentioned is European health insurance card, and the other thing, and I come back to that, is the European digital certificate. But here there was a lot of misconception and fake news about this. So I also like to make some things clear. So European digital COVID certificate was made to facilitate free movement. European Union does not regulate, it does not have power to regulate what member states do with European health insurance, with the digital COVID certificate within their territory. Why am I mentioning this? Because some member states, for instance, introduced the requirement that if you want to access hospitals, for instance, you need to have European digital certificate. But this has nothing to do with the EU. This is a completely national decision whether to use certificate in what circumstances, in what context within their own territory. So EU is only concerned with this cross-border movement. So this is important because these limitations, additional limitations which were provided by the member states, that was not ordered by the EU. This is what each member state decides on its own. I think this is very important. So the EU created a certificate to facilitate free movement and not to impose additional restrictions. That is very crucial. Also, I have to say about the digital certificate, one problem with this, and this is what I tackled in the parliament, but I was not successful, is that it leaves too much possibilities for member states to impose restrictions to people who have certificates. So we left the possibility in the regulation that member states can impose restrictions on free movement even to people who are crossing the border who have certificates. And that was the problem because some member states did that, so they didn't allow people who had certificate to enter their territory without additional testing or whatever. And that was one of the big problems. Why did this happen? Because every regulation which is made on EU level needs to be approved by the Council. And in the Council, you have representatives of the member states. So you need to get a big majority of the member states to agree on something. And of course, the problem is that many rules that we, as the Parliament, want and the Commission wants are then diluted and weakened by the member states and the Council. But this is how European Union works, how European Union functions. So we have, in the decision-making process, we have both the directly elected MEPs and the representatives of the member states who have to come to an agreement. So to sum up, EU can do a lot to facilitate free movement. It has already done that. European Health Insurance Card digital certificate. The purpose of digital certificate was not to impose additional restrictions, but this division of powers between the member states and the EU still, unfortunately, allows member states to limit free movement when it suits some political interests within their national government.
Thank you very much. That was extremely comprehensive, and I'm sure many people took notes. And I also liked, the clarity on how you explain it, the example, the practical example you make, and also obviously the enthusiasm you have in trying to move this and the whole European Union forward. I would ask you now, MEP, to listen a bit to the two students, because we would like to, before we open up for a Q&A, and again, if you're watching this webinar, please write down on the platform where you are, just write down your question so that we will be able to pose it to the panelists later. I'd like to ask the two representatives of a student organization how they see the future, and then MEP, if there is anything that you can pick up on that, or happy to hear your point of it. So we start with Katarina from EBSA. You guys published a report which called, looking at digitalization as well, which called for greater education on digital healthcare. So try to educate young people on digital healthcare within the pharmaceutical curricula. So it's very specific for your student association. How much potential do you see for universal pharmaceutical education program across member states? And what was your request in this report that you published? And looking at the future, what would be your, let's say, as an organization, but also as a student, as a young person who's gonna, live and experience Europe for most of your life? You're very young, so a lot of policies that are taken now will affect most of your life. How do you see the future in this?
Well, we see a lot of potential in EBSA. We've been advocating for this unification of the curricula in member states and in Europe for a long time, for quite some years, because students at the end of the day seek for equal opportunities in education, and therefore by having an unification of the pharmaceutical curricula in Europe, this would help to set consistent standards in healthcare and would facilitate the mobility of professionals as well. Because all students would have the same educational pillars at the end of the day. There would be no differences in working conditions, in respect to the profession, or in status in society. And pharmacists would be able to protect and present their profession better. And the pharmaceutical degree as well would be recognized all over Europe without the need of notification. So by developing a unified curricula, we could strive towards precise goals in order to serve patients in the best way possible. So we would have a quality of education that would allow professionals to follow pharmaceutical development more easily, and the evaluation of a potential employee skill set would be less of an obstacle when searching for a job abroad. And for example, in regarding to vaccination, because we are on this topic, by implementing mandatory hard skills trainings on vaccination topics and including accessible practical training on vaccination during the pharmaceutical undergraduate degrees, this would allow for all future pharmacists to be educated and to educate their communities. And it would empower as well pharmaceutical students to take part in the working force to fight vaccination hesitancy, which is another topic that we talked here. So by having this unification of the curricula, by giving students the same opportunities and the same education, we would have all over Europe, all over our member states, more qualified and equally qualified pharmacists and educators in the workforce.
Thank you very much. Very clear, very passionate, and very practical as well, which is what we need. Sometimes young people are obviously in a beautiful way, dreaming of things that are not so practically linked to what is potentially possible or there, but it was very, very well thought and very well put. Thank you, Katarina. And then I'll ask the MEP later to reply. But first, Sila from the European Medical Student Association, and also from yourself. What change would you like to see on the European regulatory level to ensure healthcare industry is better prepared to support another possible pandemic, or any other request that you guys or thought for the future, looking at the future that you guys might have?
Thank you. So while we are at the point to think about the lessons we learned from the pandemic, I believe that this is the moment to strengthen primary healthcare globally and in Europe. So, as we know, millions of people died and affected, while a generation of students faced a learning crisis. So it's been a clear reminder that there's a need to build resilient health systems. So better primary health care will help us to protect against future pandemics. And the major point from my view would be prioritizing pandemic preparedness and response related with healthcare workers. Because our future is healthcare workers, because we are now medical students and we will be the health workers in the future pandemics. So healthcare workers are in the center of healthcare systems, and throughout the COVID-19 pandemic, healthcare workers faced emotional and physical issues and compelling work standards. And it was different. It was different between countries and also within the countries. So to try and protect against future pandemics, healthcare workers must be prioritized, and that means providing them with the necessary training and making sure they are primarily protected and financially and emotionally supporting them. And that includes building a common framework across Europe to avoid disparities. And as a medical students, we will be the healthcare workers, so we need trainings, tools, guides, and maybe cases to be prepared. And as a conclusion, when policies are innovating, lessons from COVID-19 must be analyzed and should be presenting while enhancing they are available and accessible for current and future healthcare workers.
Thank you very much. And again, I liked how this new generation are becoming extremely on a topic that can be achieved and tackled. And then MEP Sokol, now I pass you the word. We have two very clear, let's say, requests. One is the unification of, can I say, curricula all over Europe for pharma students, so that a Portuguese pharmacist can potentially find a job in Germany and be helpful in a pharmacy in Germany, and vice versa. As Swedish could find it in Croatia potentially, and that's definitely one. Also because we've seen during the pandemic some systems were under big stress because of a lack of workers, while others weren't, and also unemployment is very high in Europe in certain regions, whilst it's youth unemployment, while it's low in others. So allowing this would be great. The second part from Sila, and again, I appreciate that young people back in the days they were asking for a lot of money, and all of you mentioned the word financial once, and you keep talking about training and education and mental support. So again, if there is a way in which we could unify trading for medical workers, for healthcare workers, as to ensure also some mental health support, is there something that Europe can do in these two things that you see the European Parliament can do?
Okay, thank you. So very concretely, so we already have the directive on recognition of professional qualifications. The last version is from 2005. And there you have the principle of automatic recognition of qualification, which applies to certain professions, but the area where this is probably most regulated is healthcare. For instance, for pharmacists, it is required that if you want your diploma to be recognized in other countries, then it has to be at least 5 years of training. And it is even prescribed which basic things you have to learn through this training. And it's set in the annex of this directive. So you have to learn plant and animal biology, physics, general and inorganic chemistry, analytical chemistry, anatomy, microbiology, etc. So here we already have some level of harmonization. So if your course, if your studies that you studied for pharmacists fulfill these conditions, so at least 5 years out of which 6 months has to be practiced, and you have studied all of these things that I mentioned and some others which are prescribed, then your qualification is automatically recognized in other member states. Plus the fact that for all healthcare workers, also for doctors, you have in this annex to this directive, you have a list of diplomas, of specializations in all European languages. So for instance, if you get your diploma from Portugal, then you go to Germany, and you want to get a job there in a hospital, then they will look at this annex, see this Portuguese diploma, which is the German equivalent, and then it makes it much easier for you to get employed. So actually, when you speak of recognition of qualification, this is where Europe has has made the biggest advances, let's say. What Europe cannot do, however, is to harmonize more than this. So we cannot completely unify curricula, determine what will be learned, what will be, I don't know, the textbooks, and going too much into context. But as I said, so this is something which is again national competence. But what EU can do is to determine these minimum conditions for certain professions, certain diplomas to be recognized in other member states. So this is what EU can do. But when you speak of, that's one thing. When you speak of the financial part and the overall training, etc., again, this is primarily national competence. So we cannot unify this on European level. For instance, determine what will be minimum salaries for doctors who are in training or who are in trainees or something like that. But what EU is doing, it is providing money from EU budget through your so-called European cohesion policy funds, especially from European Social Fund, to the member states for different things. But then the member states are the ones who in the end decide how they will spend this money. For instance, Croatia has financed a lot of specializations from this European Social Fund. So this is one possibility, but this again, the way how this money from EU funds is being spent is again left to the member states. Of course, there are some other things where EU has stronger role. For instance, in research and innovation, that is very important. Healthcare has a big role to play. We have Erasmus, we have the Horizon program, which is directly financed from EU budget, where you can make a project in terms of research and innovation. Medicine is one of the areas which is most well presented in this program, and this is funded directly from the EU Commission, and EU Commission decides who will get the money, not the member states. So this is a more centralized program. But as I said, in case of how EU can support training and provide help to the national policies, this is what EU can do. So provide help and support to national policies. But how this money will be spent and what will be the working conditions of doctors and healthcare professionals in the end, again, depends on the member states. So unfortunately, but it is as it is now. If we want to change this, we would have to change the founding treaties. Again, all the member states would have to accept this, and that is not realistic in the short term.
Thank you very much. We now move on to the Q&A. So we are opening up for the public to share their questions. And the first one is from Helena. For Amit, how can scientists be involved to help communicate the medical side of vaccine to those who do not have a scientific background?
That's a very good, I was on mute, sorry. That's a very good question. That's an excellent question, because I've seen that personally at my level. When you say to people that, okay, I'm working right now on manufacturing of a COVID vaccine, people want to know more. So people are very interested in what you do, and you have to make sure that you are able to, let's say, to make things easily understandable for people who do not have a background in science, to give them appropriate information that are relevant at their own level, but not too, let's say, not too complex, not too deep, to make it understandable. And what I was surprised by is that really, if you explain to people, okay, so this is how we do, we start, this is the manufacturing process, we do that, we grow some cells, we grow bacteria or virus, we kill the virus, blah, blah. You explain things in a very simple way. People get very interested, and you describe to them, okay, I'm going to walk you through the production, tell you how much we put control around, let's say, the manufacturing. If you manufacture one dose, it may take 2 weeks to do it, but then you will get, for example, 5 months of quality control. And if you tell that to people, they're like, oh, so you build something for 1 week and you have like 10 times longer of quality control. So it reassures people to know, like behind the scenes, what is actually happening on vaccines. You tell them that the quality control that you have on one dose is huge, and it's the longest thing you do before you put any vaccine available on the market. And being able to tell people, okay, this is how we do, this is how serious we are around it, this is how severe the quality is. So we are sure that what we do, we can inject it to ourselves. So this is why I was very confident about the COVID vaccine, is that I was in the factory. We spent nights and days in the factory, and I was like, okay, the day we finish the batch, if it goes to clinicals, I can get the shot. I volunteer to get the shot because I've seen it. I'm confident with it, and being close to it makes you more confident. So this is how we should, as vaccine manufacturers, we should approach the general public to make sure that we get closer and to explain what we do, and there should not be any opacity around what we do. So that's very important to be fully open and to get people trust. That's a key point, I think, to decrease the hesitancy.
Thank you very much. The next question, this is from Havit to all. Are we neglecting most frequently used channels by young people, for example, TikTok, to transmit pro-vaccination messages? And how should we share these messages in such channels? Who should lead this? Ooh. Who would like to take this? Probably either one of two young one or MVP. That's who would like to take this? If we're neglecting most frequently used channels by young people when we give certain vaccination messages.
I can say something about that. I don't think that we are neglecting or the organizations are neglecting these channels, but it's clear that channels and the social media platforms are evolving, because it was Instagram before, now TikTok, and we don't know next what will be. It's not about only vaccination, but when I attend some session with WHO and alcohol police, it was the point about TikTok and social media to reach out young people. So I think that young organization can handle this role, and also with the support of WHO. So it is important to give opportunities to young people for leaderships in vaccines and other healthcare issues, and then we can produce, and all can produce, some content for young people in TikTok, because I believe that to produce this content, young people is necessary, but with the support of organizations such as the EU and also WHO.
Thank you, Sila. Next question. Esther, how can we make sure those from more disadvantaged backgrounds are not excluded from advancing in digital healthcare? That's a nice one. So we're all talking about digital and advancing digital healthcare, but it is true that there are some people in more disadvantaged background that are probably not so familiar with digital tools. Is how can we make sure we're not excluding them? Katarina, would you like to take that?
Yes. Well, I think that by asking this type of questions, it's the first solution to not excluding people from more disadvantaged backgrounds, because we would keep them in mind even if we are advancing with digital healthcare. So we know that from one hand, it's easier to have these digital tools and to optimize them, like Sila was saying, with social media platforms to reach younger generations and young people. But at the same time, we also know that some people, even if not from disadvantaged backgrounds, just don't know how to deal with digital and the new digital tools that the younger generation are used to. So I think that the way to proceed is to find a balance between what digital could bring to the table and to what population are we talking about with digital. Because I know that in some countries in Europe, we already have, for example, e-prescription. And now I'm talking a little bit more about pharmacy from my background. But this is a huge optimization for the pharmacy profession with digital tools, was the e-prescription. But the balance that I'm talking about is giving the opportunity for the population in question to decide that if they want to have a digital or a non-digital path with their prescription. So for example, offering the two options. Would they want a manual prescription to still bring to your pharmacy, or would you want a e-prescription to bring to your pharmacy? Of course, there are some benefits and disadvantages of having digital, and we could talk about sustainability with digital as well. But here goes the question: we would be excluding people from disadvantages backgrounds, or that just don't have the expertise in digital, and we cannot afford to do that, because we would talk about minorities, we would talk about elderly population, and these are crucial groups for us as well in the healthcare field.
If I may just add something, I think when we speak about disadvantaged groups, it's a very broad definition, so it can really include a lot of different categories. But for some categories, actually, digital can be helpful and can actually be beneficial. For instance, I've been strongly advocating stronger investments into digital infrastructure in rural areas. So rural areas, villages. So a lot of population of Europe live in rural areas, and if they want to go to a hospital to get regular checkups, sometimes they have to travel 50 kilometers, 100 kilometers, etc. So for this group of people, for instance, having telemedicine, so that you can make at least some diagnostics online without having to travel back and forth, can be actually an advantage. So this is also something so it can also be beneficial for some disadvantaged groups. But of course, if you want to make this work, they have to invest more into building basic infrastructure in rural areas. So this is something that I've been really strongly advocating here in the Parliament. I've been one of the co-chairs of the group on smart villages, etc. Also about the right to choose, I think that is very important, especially in the transition period when something is relatively new, when even people who are not maybe very, very old, but maybe something in between, but are still not used to it. I think that we should do as much as possible to give this freedom of choice to the people, because again, not to have this kind of a perception that we are forcing something upon them. So this is something very important. Of course, there are different ways of. So I agree. More digital issues in the education in each member state, more public campaigns about raising awareness and things like that. But I think in general, if we do this right, a lot of these digital tools can actually help disadvantaged groups and not be to the detriment of them.
Thank you, MP Sokol. Thanks very much. And we are getting to the end of this very informative and super nice webinar, and also very energetic, which I like and which we all like. It's been an absolute pleasure to have you. Before I let you go, I'd like to ask each one of you for your very final point, 30 seconds each, so that we stay within the time. And so I might start from Hamid. What would be, if you were to send a final message in 30 seconds about the topic of today, what would that be?
If I had to say a final message, is that we should make sure that people get a bit more knowledgeable about vaccines. Make sure that we have a basic culture of information regarding vaccines. The more we know about it, the more we trust, the more you know the product, the more you feel confident to use it. And I really think that people should try to have interest in how the vaccine industry works. It's really interesting. The science behind it is amazing, and the people working on it are making great efforts to make sure that the doses are safe and they provide huge benefits for the society. So yes, we should strive to make it more knowledgeable to the public. That's my final point.
Thank you very much. Katarina, on to you.
I guess that my final message is for everyone to trust the young people. by giving them the right education, by giving them the right set of skills, the training. And we have very good education programs through all member states. By trusting on them, by educating them, by trying to overcome the hesitancy that they have, not only towards vaccine and vaccination, but in general in healthcare, and strive for health literacy, we will have young people that are educated and that can help us as well educate their communities. So we should always trust young people to do better, because they are the future of Europe and the future of the world.
Thank you very much, Katarina. Sila?
Yeah, first of all, I agree with Katarina. And if I add something to this, communication is essential to tackle challenges, not only for pandemics. And as this webinar, while exploring the ways to communicate with young people, I believe that efforts should include to communication education for young people. And we are the generation to lead the change. And leadership opportunities for young people on vaccines and pandemics should be offered by the EU and other organizations. So I believe that the steps taken regarding the youth will be mutual and increase confidence, and better future awaits us in a unity.
Thank you very much. Last words to MEP Sokol, your very last message.
Thank you very much. Young educated people are the ones who can benefit the most from European Union. So from student exchanges, Erasmus, free movement, possibilities to get jobs in our member states, recognition of diplomas. So all of these things are really benefiting the most young educated people. So it is important that you stay engaged, that you stay connected with the topics which are interesting, to also define your positions and put pressure on the policymakers. The discussion on COVID-19 vaccination is something very important. The digital COVID certificate has shown us that you can resolve some problems which member states cannot resolve by themselves. I hope that we will continue in this direction, and it is important that we, as the policymakers, work together, and that we also do not lose touch with young people, which is getting harder every day. But it is crucial, it is essential that you really follow what's going on European level, that you are connected with this, that you are active, that you propose your own solutions and you make your points of views known on different things, including vaccination. And by doing that, you will be able to include things which are of interest for you in the European policies, and I will do whatever I can to support you in that.
Thank you very much. And thank you everyone first the speakers for participating in this webinar, our team for organizing this, and everyone who watched. You can keep following all the work of Think Young in respect to healthcare and the Vaccine Coalition under thinkyoung.eu/Vaccine Coalition. That's where you find all the information in case you would like to join it as well, the Think Young Vaccine Coalition. And stay tuned, because we have many webinars coming for the autumn and winter. And again, thanks a lot for the time you took today. And you will have obviously the full webinar uploaded on all our social media straight after. So in case you missed the beginning, you can watch it again. Thanks a lot and have a great day.